Catastrophic plunger incidents, freaking laser beams, and you know what I'm about to say, don't pull it out. Today, we're breaking down and reacting to all of the machine-induced medical scenes and terrifying injuries from the highly popular YouTube series, Skibidi Toilet. Let's dive right in. Oh, puncture wounds to the head itself. If it goes into the face, probably is okay. You'll end up getting fractured. But if it goes into the brain, through the skull, probably not survivable. Oi. Pretty cool that you can see the bones on the right arm. It's depicted really well, especially at the elbow. You can actually see the ulna and the radius. Gunshot wounds to the head, depending on caliber, distance, and area the brain hit, could lead to bleeding the brain, traumatic brain injury versus succumbing to the injury. Oi, getting hit in the head with a morning star. Not something that typically comes to the emergency department. We typically will deal with blunt trauma to the head, metal objects, hammers, rebar, baseball bats. We'll end up getting a CT scan of the head, neck, and face, depending on the areas. Okay, direct trauma to the left eye. You're getting a puncture wound to your globe, the eye itself. We get worried about all the fluid coming out of the eye besides the integrity of the structure of the eye. So the ophthalmologist, which is the eye surgeon, needs to evaluate, is there something that's salvageable? Can you still save the eye? Just watching that hurts my hand. All I can think about is broken bone, broken bone, broken bone. Typically when people punch something super hard, they punch with the wrong parts of their hand and they hit with these two knuckles, and these two bones decide to go and snap and cause a boxer's fracture. Oh! Massive blade right through the side of the head, going through the ear. So you already have part of a hole there, but on the other side is all the structures relating to the hearing apparatus as well as our vestibular apparatus. So having to know where we are in space. So you get really dizzy real quick. I always tell you, don't pull it out. Pull it out and now you're gonna have bleeding, a lot of swelling to this area. Doesn't necessarily mean somebody's dead or going to die, but we'll get somebody to come to the hospital. Emergent imaging, we'll likely have to intubate this individual, have a neurosurgeon take a look at them. Oh, malfunction and self-injury. The worst type of self-injury that we do see is accidental discharge of somebody's own handgun, where it's in the inappropriate position and they shoot their own leg or hip or genitals. Yes, this does happen. Explosions.
Explodes.
Pneumothorax, hemothorax, so lungs can pop open, eardrums might burst, and then you're dealing with the burns thereafter. From an emergency standpoint, burns are pain management control, prevent infection, and then also fluid hydration because you're losing fluids. A lot of destruction happening. We'll see people come in groups to the emergency department. There's something called mass casualty accidents, but we'll just have, big car accident where there's 4 or 5 people come. And that's when you actually really use your triage system. You're triaging individuals of who needs immediate care, who can wait a little bit, and who potentially is going to succumb to the injury. Whoa. Missing the eye. When people actually have one eye, monocular vision, you'll eventually be able to have better depth perception after the body and brain gets used to it. But at the beginning, your depth perception is going to be a little bit off because you do not have binocular vision. Big injury, laceration to the side of the head. That blade is really long, can go right into the brain tissue. And if it hits deep enough and cause enough bleeding, can cause pressure in the brain, causing brain herniation, or just the trauma to the brain tissue itself. Whoa. After watching the chaos that is Skibidi Toilet, my brain could use a chill pill. That's where Chillax can help to bring back those chill vibes. You can grab Chillax at lifehappens.com or on Amazon and get back that balanced feeling. Ouch. Electrocution to the head. The big things that we worry about cardiovascularly, what is happening? You're having so much impulse of electricity to the heart, it can send your heart into ventricular tachycardia, ventricular fibrillation, and cause you to go pulseless. Whoa, just chilling. It fries your nerves, so your function of the nerves don't work anymore. It will also fry your tissue, causing muscle breakdown, rhabdomyolysis, kidney failure, elevated potassium levels. A lot of bad things happening. Head injury down onto the concrete. We see a lot of injuries that way, not being forced this way, but when people fall, they hit their head. Skull fractures, intracranial bleeding, as well as the soft tissue injuries that we need to repair. What? Did you all just see that move with the blade to the side of the temple? There was a twist.
Twist it.
Twisting it will cause more damage. Please don't do that to each other. Oh my gosh, the knife's still on the side. That knife could be going through the bottom aspect of the frontal lobe, might be missing it, could have caused eye trauma in the back, hitting the muscles and the optic nerve and going straight through. Whoa. The beams here are just high energy, thus causing destruction of the tissue. Energies like the sun has super high heat, the crematoriums. We typically don't have this type of energy at the hospital. We do use like cautery as heat to help with different wounds. So surgery, they have the Bowie knife. It's a knife, but it also gets heated up so you can actually cauterize things. Ooh. A lot of head injuries because we have heads in the toilet. Most of these injuries that I see relating to head injuries is blunt trauma. We do not see a lot of penetrating trauma outside of gunshot wounds. Most of them are likely fatal and they don't make it to the hospital. Whoa, that reminds me of the mountain from Game of Thrones. It could happen. Not compatible with life, not something that shows up to the emergency department, not something that's even taken by the medical examiner's office. Whoa, oh, we know what's happening here. We get an attempt at good anatomy of cervical spine, the connective tissue, as well as almost bones. So good job for the creators. Oh. Whoa, regeneration here. Actually super cool. I'm just looking at the neck itself.
Look at that neck!
We're seeing pieces, what it looks like possibly maybe a trachea. That would be really cool versus just bones of the spine in the back. I hope you guys learned something. Hopefully I entertained you with this react video. And if you guys enjoyed this, definitely check out this playlist right here. Do me a favor, binge watch everything and subscribe, turn on the bell notifications and hit that like button for me. Thanks so much for watching and stay healthy, my friends.